Today's topic is preventing sexual abuse in the home, incest, and sibling sexual abuse. So, this is perhaps one of the most understudied areas, and it's kind of shocking given that proportionately most children are abused within the home. You'll see the term incest, that was a term that was used historically, and it had then switched to intrafamilial sexual abuse, but now many survivors are embracing the term incest again. And so just be mindful that intrafamilial sexual abuse or incest means the same thing. It means sexual abuse by somebody that you are related to. And we'll talk a little bit about the definition of that. So, incest is sexual abuse by a parent or close relative. So that could be an uncle, an aunt, a cousin, but it could also, in the terms of the research that we do, we also define kind of step relationships as incestuous, even though they're not related by blood, or it would be considered intrafamilial sexual abuse. We often see the stepfather as a perpetrator. Sibling sexual abuse or sibling sexual harm. We talked about language when we talked about youth who sexually offend. So the terms are kind of used interchangeably, SSA and SSH. However, thinking about that, young people are still rehabilitatable, and often people, who have engaged in sibling sexual harm have been, coming from very dysfunctional family lives. We tried to conceptualize it as sibling sexual harm, meaning that we're not pathologizing the perpetrating sibling, but rather we see them as a child in need of help, and we're going to be providing them with services. But it's harmful sexual behavior between siblings or sibling-like relationships. So this could be, step siblings as well, even if they're not biologically related. And so one of the key definitions between sibling sexual harm and normative kind of exploratory sexual behavior between children is the kind of the scope of the problem. So it is normal for children when they're growing up to kind of, I'll show you yours if you show me mine, even some, potential touching. That is not, it's kind of sexual exploration. However, we see that it becomes sibling sexual harm when one sibling is significantly older than the other sibling. There is force used, and the sibling who is being experiencing the victimization is not consenting. They don't want that behavior, or the behaviors are particularly invasive. So when you're thinking about penetration or oral sex. So you kind of, when you look at the scope of the behavior, those are kind of some of the things that differentiate sibling sexual harm from normative kind of sibling sexual curiosity. It's estimated that about a third of childhood sexual abuse is intrafamilial, meaning that it happens within the home. We don't really have great data on sibling sexual abuse prevalence. It's estimated anywhere from 1.3 to 11% of all child sexual abuse. In our study of over 1,000 adult survivors of childhood sexual abuse, about 5% reporting the perpetrator was a sibling or sibling-like relationship. And so, I think while, historically, when we thought about mandated reporter laws, a lot of the mandated reports were due to sexual abuse within the home, we really don't focus a lot of our prevention efforts on sexual abuse within the home because, we're thinking about the parents as the guardians. But when the parents are the perpetrators, what do we do? How do we help children in those situations? There's also a lot of shame and stigma, and when the perpetrator is somebody in your family or who your family is dependent upon, there's a lot of confusion. This is somebody who is supposed to love me, protect me, and they're doing this. And depending on the age of the child as well, there could be not understanding because you learn your norms about behavior in the home. And so if the person who is supposed to be protecting you is abusing you, how do you know that that is wrong? In terms of the characteristics of the perpetrator, the majority of intrafamilial abusers are male, and often fathers or stepfathers. In terms of sibling sexual harm, we see the perpetrators are often older siblings. We see on average about 5 years older, and it's usually a male-female dyad, with the male being the perpetrator and the female experiencing victimizations, although you can see all permutations and combinations of that. when you look at the characteristics of those who offend within the home, we see that they're less antisocial and sexually deviant than people who offend outside of the home. So, for example, people that perpetrate abuse within institutions or with stranger victims. So we don't see them as criminalized. In terms of those who experience victimization, it's usually younger children or female siblings. They often experience worse long-term psychological outcomes because, they often don't disclose because of the nature of the family dynamic. And so they're dealing with this. The abuse is often more pervasive as well because it goes on for many years, because the parent has continued, or the perpetrator has generally continued access to the child. And in instances when families know and they don't do anything about it, that really kind of is, it compounds the trauma because there's such a violation of that familial relationship. So if a non-offending parent is aware and they don't do anything to help the child, or if the child discloses and nothing is done, you get that learned helplessness that you learned about in your psychology classes. So why does it happen in families? I mean, if we think about the risk factors that we've talked about throughout this class, access to children is the biggest risk factor. So in the home, family members have unfettered access to children. There is no generally big brother looking in. And so they have, proximity and access to the child. It also generally happens within dysfunctional family systems. So there's usually other types of abuse going on in the home. And we see kind of, neglect, secrecy, boundary violations across a number of different areas. And we also see that abuse, is kind of a learned behavior and intergenerational pattern, so that the perpetrators may have been abused in their home, not necessarily even sexually, but that it has happened to them with siblings, though not, 100%. We often see that they have been abused somewhere, or they've accessed pornography is the biggest risk factor these days, and then they're kind of engaging in those types of behaviors with younger siblings. So one of the problems, there are many problems with intrafamilial sexual abuse, but the biggest problem is that the kids in families where there's intrafamilial sexual abuse are least likely to disclose, generally for fear of not being believed or a family breakdown. So if you tell your parents that a sibling or that one of the stepfather is the perpetrator, that could lead to the family breaking apart. There might be financial dependence on the perpetrator. There might be emotional dependence on the perpetrator, and there's the fear that the non-offending parent, if it's a parent that's the perpetrator, might not believe you, and then that is like emotionally devastating. Because grooming is involved in intrafamilial sexual abuse, there's loyalty to the abuser. And especially in cases of sibling sexual abuse, because it's often happening in the context of dysfunctional families, your sibling is your ally against kind of that dysfunction. And so if they're also abusing you, it's kind of this mixed loyalty. We did a study of sexual grooming within sibling sexual harm, and we found that grooming does exist, although similar to the youth-on-youth sexual abuse, there were not as many, gaining access and isolation behaviors, because the, siblings often or do have a lot of, unsupervised contact with each other. And so that's not, kind of something that is not normal. We also see a lot of shame, confusion, and normalization of the abuse that kind of leads to prevention of disclosure. We talked a little bit about how sibling sexual harm is often minimized, that it's not so bad, that it's kind of normative, but it's really important for people who work with kids to understand the distinction, as we talked about, between harmful behavior and normal kind of exploratory behavior. But what we do see consistently across cases of sibling sexual harm is power differential. So often that older sibling and the younger sibling, and coercion. So you have to do this, otherwise I'm going to tell on you, or our family's going to break up. Or so they're using kind of some sort of threats so that the child will kind of engage in the sexual behaviors. And, even if the younger sibling isn't immediately aware that what has happened to them is sexual abuse, that probably will cause them trauma at some point when they recognize how those boundaries have been violated. And so we often see, delays in the onsets of depression and PTSD with kids who experience childhood sexual abuse, especially when the children are younger, because their understanding and recognition of what has happened to them kind of develops as their understanding about human sexuality and boundaries and stuff develops as well. Part of the problem in studying sibling sexual harm, and we have a lot of groups now, and especially advocacy groups, these are survivors of sibling sexual harm, who have been working to better understand this problem, and there have been a bunch of special issues in the last several years dedicated to sibling sexual harm. There's even been a whole conference dedicated to it, but there's really no consensus on the definition across disciplines of what exactly it is. So I think that's been a priority for researchers. There's also, people aren't trained in this, and so it doesn't come to the attention of people who are particularly knowledgeable about the distinction between normative behavior and sibling sexual harm. And so people don't know who to report to and what they do if another sibling is engaging in the harmful behavior. And so there might be, it might seem like both are consenting. There are varying degrees of severity of behaviors, and so it's all pretty confusing. And so really having a clear definition is imperative. But we do know that one of the things that we're seeing is that there are dysfunctional family systems. And so this really is at the heart of what is, leading to these abuses. There are often, substance use problems, mental health issues. And so their child is lacking guardianship for a variety of reasons. And so they don't really have anybody to kind of go to and talk about this. And there's often, even if they come out and tell somebody in the family, there's the denial. People may know and they're not telling because it's shameful. There's that secrecy. And really just, there's often a confusion of roles. So who is the parent, who is the child? So you have the adultification of younger children, often in these types of dysfunctional families. And so, when we're thinking about interventions for, sibling sexual harm or intrafamilial sexual abuse, but specifically sibling sexual harm where you're trying to reunite the family, you really need a whole family intervention. So not only the child who's the perpetrator, the child who's been victimized, but the whole family often needs to be seen in treatment because it's kind of a healing process. We already talked about that. CEDAW, the article that you read, they found that intrafamilial offenders had less antisocial behaviors and less sexual paraphilias. They are more likely to have poor attachment histories and a history of childhood sexual abuse. And so we're really thinking about how do we prevent this in the home? And I think that's really a very important question because it's really very hard. And I think that's where these school-based interventions, where we're providing, normative sexual education for kids and how to report, because oftentimes the school might be the only safe place for the child. And then the McCartan and colleagues' findings, we know that sibling sexual harm is complex, and you need to have a multi-level response to this in order to identify these families who might be at risk and then provide them with services and treatment to kind of help both rehabilitate the child who's engaging in the harmful behavior, but also help the child who is a survivor and then work with the family reunification process if that's something that's going on. We're trying as much as possible to keep the criminal justice system, at bay so that these kids aren't ending up in the criminal justice system, but really are getting mental health help for whatever they're engaging in. But we also have to remember that the child who's experienced the victimization needs to be kept safe. When it's an adult perpetrator, we generally don't work on getting families back together again, although in some cases that does happen, and there's some guidelines for that, and everybody has to be on board. Although the sparse research that exists suggests that kids will go along with it because it's something the family will want, but it's not something they necessarily want. But we really have to think about these family-centered strategies and identifying these at-risk families. There's currently a lack of consistent, national guidelines on how to address, harm within the family, and professionals really aren't well equipped to address sibling sexual harm and incest in general. And we really need to, kind of think about incorporating this in mental health treatment and training, that this is an issue, because it's probably not something that any of you have yet discussed in any of your classes. So what does prevention look like? Education on healthy boundaries for children and parents, and that's kind of where Erin's Law can come in. And we want to get this early because we know that a lot of kids who are being abused in the home are abused at younger ages. than kids that are abused outside of the home. We want to strengthen family functioning and communication, so identifying these at-risk families and providing them with services, and then really getting that identification as early as we possibly can. But it's hard because people have to be willing to engage, and it's hard to have, the state intervening in family lives. So it's really an ongoing challenge, but I think it's a neglected area for prevention because, it was really kind of shocking to me as I talk about, preventing childhood sexual abuse. I always talk about the parent or the guardian, but what do you do when it is the parent and the guardian? And that is in up to 1/3 of the cases. And so we have to think more broadly on what we can do to protect these children in our environment. So what do we know that works? Multisystemic family therapy really can be helpful because that's targeting, that socioecological model, the individual, the family, as well as the systems around the family. When abuse has happened in the home, especially in sibling sexual harm, there's restorative justice models that can help guide the family reunification process. Again, if it is an adult and a child, that is, often questionable, but when you're seeing, youth on youth or sibling sexual harm, oftentimes you do want to reincorporate both the victim, the perpetrating child, back into the family. And we want to make sure that we are engaging families as complete units, because as we learned, it's not just the child that is problematic. It is, often within the context of familial kind of chaos. And so in terms of our call to action, I think if nothing else, we need to wake up to the fact that up to 1/3 of childhood sexual abuse happens in the home, and we're not doing a lot to prevent that. And so we really have to think about it as a public health issue, and we need to focus attention to studying this problem a little bit more. There's not a ton of research on it, even though a lot of people are abused in the home. I think part of the problem is the shame that we have that somehow it is the child's fault if they've been abused in the home. Incest historically and even today is considered to be a significant societal taboo. Nobody wants to hear about it or talk about it. And so we really need to collaborate kind of across disciplines and to really identify, what's going on, to fill these gaps, to study these problems, sibling sexual harm, intrafamilial sexual abuse, to better understand the modus operandi and where we can intervene. Where are the steps along the way? What are the warning signs that we can do to help these kids, to get them out of these situations and to keep them safe? So thank you so much.